Health Minister Dr. Harsh Vardhan says Indian vaccine will work as sanjeevani in fight against COVID-19. The news in detail. Union Health Minister Harsh Vardhan today appealed to the masses to not pay attention to any rumours against the two COVID vaccines that have been approved for emergency use. The vaccines are sanjeevani as described by the leader and said the country has entered into the decisive phase of the war against the coronavirus. It must be noted that the minister's words came in the midst of a lot of questions arising on social media about COVID vaccination. The main question that is circulating in the social media is what is the significance of saying that the vaccine was invented and that people should get vaccinated as the vaccine does not immunize the recipient, does not eliminate the virus, does not prevent death, does not eliminate the need for travel bans, does not eliminate the need for lockdowns and not even eliminate the use of masks, then what is the significance of taking the vaccination? Also, questions are arising as who is the real beneficiary from the vaccines. Also, there is a strong propaganda circulating on social media that people are not getting any benefits and that only vaccine manufacturers are making financial gains. Another concern is that vaccines do not always have to be effective because the novel coronary mutations occur over time. As a reply to all this misleading information, today Union Health Minister Harsh Vardhan said that misinformation is being spread about the vaccines and urged the media to help in dispelling the rumours. He added that these vaccines are sanjeevani in our fight against this pandemic. We have won the battles against polio and smallpox. Now we have reached the decisive phase of winning the war against the coronavirus, he was quoted as saying by news agency PTI. The leader was at Delhi's AIIMS today when the first shot of the vaccine was administered to a sanitation worker minutes after Prime Minister Narendra Modi virtually launched the country's vaccination drive against the virus. We have been able to put up a valiant fight against the disease during the last 1 year. Adopting a preemptive and proactive strategy has resulted in a very good performance by India. We have probably the lowest fatality rate in the world, he added. The minister also thanked the doctors, nurses, healthcare staff, security personnel and media for supporting the country's vaccine efforts. Built as the world's largest vaccination program covering the entire length and breadth of the country, the drive aims to first inoculate millions of its healthcare and frontline workers and reach an estimated 3 crore people by the end of its first phase. Meanwhile, chief ministers of several states attended the launch of the vaccination drive at government hospitals in their respective states. The Drugs Regulatory Body of India has currently approved 2 vaccines. Pune-based Serum Institute of India has developed the Covishield vaccine developed by AstraZeneca and Oxford University, while the Covaxin has been developed by Hyderabad's Bharat Biotech in collaboration with the Indian Medical Council of Research and National Institute of Virology. According to the Union Health Ministry, the full initial procurement amount of 1.65 doses of Covishield and Covaxin vaccines against COVID-19 have been allocated to all states and union territories in the proportion of healthcare workers database. News Desk, Karma News.